in cancer patients, diagnostic testing is the whole axis of which diagnosis is made. So a lot of times it tells you where the primary tumor is, it tells you how far the cancer is spread, to what extent it is spread, whether it's made it into the lymph nodes, and it tells you the places that it hasn't gone. It tells you the places that are free of disease. And all of these have to be taken into consideration when you determine what method and means you're going to do to treat the cancer. Before any type of decision can be made as far as treatment, you have to do staging. The number one study that any man with prostate cancer needs to be asking for is an MRI of his prostate. It's widely used in metropolitan areas. It is the mainstay for determining whether or not the disease is outside the capsule of the prostate. So any man who has been diagnosed with prostate cancer, the first step really needs to be an MRI of the prostate. Unfortunately, some practices forego that, but in our setting here, we have seen so many times that it's either improve the stage of the cancer for the patient, meaning that it wasn't as progressed as they thought it was, and that we could offer them treatment options that they weren't offered at other places based on that information. And sometimes it's actually shown us that it's a little more advanced than what they thought it was, which meant that we needed to treat the tumor more aggressively in order to increase their 5-year survival rate, whereas without it, they would have treated it less aggressively and they would have been undertreated.